The recent World Hepatitis Day tagline is "We're not waiting." It's a call to accelerate elimination efforts for viral hepatitis and the urgent need for testing and treatment. And to help in this action, we need to familiarise ourselves with what really hepatitis is, aside from knowing, it's my basic knowledge, that it affects the liver. So, joining us now, live on the line, Dr. Kaiser Raja, consultant in liver diseases, transplant hepatology, gastroenterology and advanced endoscopy at King's College Hospital, Dubai. Doctor, that must be a very, very long business card. How are you today?
Thank you so much. You can just introduce in a short form. I specialize in liver diseases. Thank you so much, Helen.
Well, thank you for being with us today. And I will stop you if it gets a bit too technical, because I'm the voice of the people today. But I think it's really important to get a bit of background information. And these awareness days are really crucial because it does kind of put something in our calendar to talk about something that we might have a little bit of information, but we might have a lot of misinformation about. So maybe we can start with that. What are some of the myths or misconceptions that you often hear around hepatitis?
Yeah, so first of all, hepatitis is inflammation of the liver. It's a very general word. It's like you have appendicitis and cholecystitis. So hepatitis is inflammation of the liver. Many things cause hepatitis. People confuse with alcoholic hepatitis. People confuse it with fat-causing hepatitis. But in this context of the World Hepatitis Day, the context is viral hepatitis. So there are many viruses which affect the liver and cause chronic inflammation. And here too, we emphasize on two main viruses which are hepatitis B and C. I mean, there are like A, B, C, D, E, but we concentrate on B and C, and that's why the WHO kind of, promotes this day as World Hepatitis Day. The idea is to spread awareness among people about hepatitis B and C. These are silent infections. They cause infection almost 350 to 400 million people all over the world.
Wow.
And a lot of people, I would say 80% of them are not aware that they are suffering from these viruses.
Gosh, can we talk about demographic then? We're talking about millions of people. Where is B and C particularly prevalent, Doctor?
Correct. So hepatitis B, for that matter, which is more important, affecting almost 350 million people all over the world, is mostly prevalent in, let's say, China, Central Asia, Southeast Asia, Africa. A lot of Africans have hepatitis B. And of course, it is found in all other places because people migrate. I mean, let's say Dubai, we have people from all over the world. We have so many Chinese people here, so many people from Africa, people from Central Asia. Hepatitis C, on the other hand, is more spread out in the world. So we have people from Southern Europe, even people from Middle East, but there are hot pockets. For example, again, Central Asia is a hot pocket. Egypt is a hot pocket. Pakistan, and Northern India is a hot pocket for hepatitis C. Mm-hmm. And of course, it's found all over Europe, North America, Japan, and Korea, So hepatitis C is more kind of spread out all over the world. But hepatitis B has got these major areas, as I said, China, Central Asia, Southeast Asia, and Africa. Yeah.
Dr. Kaiser, can you explain a little bit what happens in the body? We talked there about being inflammation of the liver. Can you break it down a little bit for us about, how you get it, first of all, and then how your body responds?
Yeah. So that's the thing, it's important to know how these hepatitis viruses, especially B and C, are spread. So usually there has to be some sort of a blood-borne contact or a sexual contact or a mother-to-child transmission. Mm-hmm. So usually hepatitis B is spread because of mother-to-child transmission between individuals, like young children, they play with each other and spread the virus, or between adults through the sexual route. Of course, there is always transmission through other blood-borne mechanisms like blood transfusions, but all those practices are now getting more refined. So all blood is tested before it is transfused from one person to another. But in olden days, yes, it was transmitted through blood transfusion, blood donation. Certain other unhealthy health practices like body piercing, tattooings, dentistry practices where your sharp instruments are used and we are not sure whether they are being cleaned properly or sterilized properly or not. Many times it's difficult to say how it's spread, but these are the important things one must know how it is spread.
Doctor, you mentioned... Sorry, go on.
Yeah, hepatitis C is also spread importantly through intravenous drug use. So in those areas, it may not be that relevant to the UAE, but when the people all over the world coming in, as I said, and if you've had an exposure to intravenous drug use, then that is very important ways of transmission for hepatitis C. Yeah.
You mentioned the words silent killer earlier, and that there are millions of people living around the world who might not realise they've contracted this. What are some of the symptoms that might start to show? And if undetected and treated, what can the consequences be?
So hepatitis B and C, they both silently damage the liver, cause liver fibrosis, and they lead to a condition which people may recognize as liver cirrhosis. And so one develops liver cirrhosis over a period of 20 to 30 years. Until you develop liver cirrhosis, really you don't have any symptoms whatsoever. Once you develop liver cirrhosis, then you get fatigue, tiredness, yellow eyes, jaundice, swelling of the feet, and then you're at risk of liver failure, liver cancer, and then it is a time when one might need a liver transplant, Now, so the problem is that we have to identify people early on when they are not reached that sort of advanced stage. And then usually there won't be any symptom of hepatitis. The best way is to, if you have any suggestion of liver disease, people go into health checks and they're found to have minimally abnormal liver function tests. They should all check for hepatitis B and C. Mm-hmm. If there's any family history, you must check. If you belong to any high, endemic area, if you're, let's say, from Africa, or you're from Egypt, or from China, Central Asia, South Asia, at least check once in a lifetime. In fact, I recommend to everyone, just check once in your lifetime. You do tests every day. You're testing your cholesterol once in a while. You're testing your sugar every year. Just check for hepatitis B and C once. Because essentially both of them are kind of curable. For hepatitis B, there is a vaccine, and now most countries have kind of established a vaccination for all the newborn. So hepatitis B, one fine day, will disappear once everyone is vaccinated on the planet, the children, as people grow up. But it's still like a huge pool, 350 million, who need to be sorted out. Hepatitis C, on the other hand, is very easy. In fact, the WHO target is 2030, eradicate hepatitis C. Wow. Because hepatitis C can be treated within 2 to 3 months. You just have to find out individuals who are infected, treat them, and they are cured. So These are all preventable and curable infections, but one must know because there's no symptom as such.
Which is why we're talking about it today. Dr. Kaiser with us today. We had a message about vaccinations, Dr. Kaiser, saying, does the UAE do all of the Hep vaccinations that you'd find elsewhere in the world? You mentioned there in terms of in newborns. So are we able to access everything that we might need? Yeah.
So, UAE does provide newborns with all the vaccinations as per the WHO protocol, And among the hepatitis viruses, we have vaccines for hepatitis A and B, which are recommended for all children below the age of 12 months. And there's a proper protocol for that, and vaccination schedules, include that hepatitis B vaccine is a course of 3 vaccines, hepatitis A vaccine is a course of 2 vaccines. But having said that, even adults can take this vaccine, especially if they think they're in a high-risk profession. For example, doctors and healthcare workers. They should they should all be vaccinated, and people who are travelers to let's say developing countries, they should be vaccinated for hepatitis A. Remember, we are all grown up, and we may not have had hepatitis A vaccine when we were born, and we were born in a country which was not giving hepatitis A vaccine, but we still travel for business purpose to developing countries where we can contract hepatitis A. Although hepatitis A is not a very serious problem, most people have a self-limiting illness. It gets better, but then it still takes off work days and things like that. And a small minority of patients, 1 to 2% patients, can really get sick with even hepatitis A. Okay. So it's good to get vaccinated for A.
Well said,
if you are
sir.
a frequent traveller. Yeah.
All right. To the text line we go, 4001, if you've got a question for the doctor of the hour. Daniela saying, not related to Hep, but since he's a liver expert, she says, I had my last alcoholic drink on Christmas Day. I was drinking far too much and thought enough is enough. 6 months later, I had some blood tests for something that turned out to be menopause related, dry mouth, but one of the blood tests showed that one of my liver enzymes was a bit raised. I've had an ultrasound on my liver. Sonographer said my liver is looking a bit bright and fatty, waiting for follow-up, but should I be worried? Now, I know at King's College Hospital, you're really on a bit of a mission to be raising awareness and education around fatty liver disease. What message would you give to Daniela? It sounds like she's made great strides in terms of lifestyle changes.
So Daniela, fatty liver is very common. Again, fat in the liver can also cause inflammation in the liver, so that would also be classified as hepatitis, and we call it steatohepatitis or fat-related hepatitis. It's got a different course, but that will also damage the liver in the long term. I mean, it will take like 3 to 4 decades to damage the liver, but it can damage the liver. So fat is also bad for the liver, and especially if you've got other risk factors. For example, if you are obese, or if you are diabetic, or if your cholesterol and triglyceride values are high, or if you've got insulin resistance, or let's say a family history of liver disease, or you have persistently elevated liver enzymes. So when we see patients with fatty liver and raised liver enzymes, of course, we again rule out other causes of liver disease. You just mentioned about alcohol. So we would exclude, people drinking excess alcohol. We would still screen you for hepatitis B and C. And then we look at a few other things, and then we say, okay, this is all fat in the liver. We look at your risk factors, diabetes, obesity, high cholesterol, and then advise you lifestyle modification. And then see whether your liver enzymes come down, whether your fat in the liver reduces or not. Sometimes we need further imaging scans, something called a fibroscan, to look at stiffness of the liver. Mm-hmm. So the liver is soft, it's a good liver. If the liver is getting firm or hard, then it's a bad liver. So fibroscan is one way of knowing which patients with fatty liver have got the simple form of fatty liver or an advanced form of fatty liver in which their liver is getting firm and fibrotic.
Okay.
Yeah.
I hope that helps, Daniela. All the very best with that follow-up. And as I said, it sounds like you're doing great work on that. Anonymous message that we'll squeeze in very quickly. I hope we can help this listener, saying, I do have some health anxiety that I'm getting help with, but recently I've been getting a random on and off sharp pain under my right rib. I've Googled, I'm worried it's some sort of liver damage. I have had a full blood test recently. It came back clear, including liver function, but I'm wondering if the doctor could have a think about what else it could be. Now, it's very difficult to give any kind of diagnosis on one message, but Dr. Kaiser, does anything come to mind, and what further investigations would you suggest?
As a quick answer, I think he should have an ultrasound scan of the abdomen to look at not just the liver, but even the gallbladder and other structures in the right side below the ribs, but at the same time, remember, if he's otherwise a young and healthy person, we don't know his demographic profile, but usually sometimes the sharp pains are quite non-specific. Mm-hmm. So not all pains really reflect that you have a liver problem, but it's good to have an ultrasound scan just to see if something is happening in the liver or gallbladder.
Dr. Kaiser, thank you so much for your time today. I feel like I've got a much deeper understanding, so tick on the hepatitis awareness push there. I think that's been fantastic. And are you able to just briefly tell us about some of the issues that you can treat there at King's when it comes to your speciality, just for anyone who might need a bit of extra help one-on-one?
Yeah, surely, anyone who needs help with any form of liver disease, abnormal liver function tests, fatty liver disease, viral hepatitis, people have liver cirrhosis, enlarged livers, other biliary tract problems, gallstones, pancreatic problems. So I basically specialize in all forms of liver, pancreatic, and gallbladder diseases. So people are most welcome to seek help if they need something.
Thank you so much. I wish my best friend and her husband were living in the UAE. He's just had a terrible time with gallbladder infections and leaking and all sorts. So he's been in and out of hospital. So I might message you privately to see if I can get a second opinion, because he's really struggling. Not fun, but thank you for all the work you do there, Dr. Kaiser. Really, really appreciate it. If you want doctor's details, just send me the word doctor, but you can find Dr. Kaiser Raja and the team there at King's College Hospital. Thank you again, sir.